Margie Apa has resigned as the CEO of Whatu Ora Health New Zealand, citing the need for a reset. Apa has been chief executive for 3 years, but has decided to step down before her term ends in June, saying a different leadership approach is required. It comes 6 months after revelations Health NZ was overspending at a rate of $130 million a month. Zane Small has more.
Flanked by a Health NZ Te Whatu Ora banner,
Well, Morena, everyone. Lovely to see you all.
Mental Health Minister Matt Ducey today paid tribute to the public health body's departing chief executive, Margie Apa.
I always found Margie someone who was very collaborative, had a lot of time for mental health.
Apa was appointed in 2021 as the first chief executive of Health NZ, which was a new mega public health body introduced by the previous Labour government.
Health NZ will replace the existing 20 district health boards to become our first truly national public health service.
3 years on and Apa has stepped down, saying today, although my term formally ends in June, Health New Zealand is at a point in the reset where a different leadership approach is required to take us forward, and I would like to make space for that now. That reset she referred to came about under the new coalition government. 6 months ago, then Health Minister Shane Reti announced that the board of Health NZ had been sacked.
It is not a decision I have taken lightly.
It followed revelations that Health NZ was on track for a deficit of $1.4 billion. To get public health spending back on track, former chair Lester Levy was appointed by the government as a commissioner.
We don't need more money, we just need to spend the money that we've got more wisely.
A few months later, Health NZ signalled that nearly 1,500 jobs would be cut, on top of more than 500 voluntary redundancies accepted earlier in the year.
It is a very blunt instrument to cut out jobs, to try and deal with cost issues in health, because what you always do, not sometimes do, always, is you shift the cost somewhere else.
Lester Levy said today that Margie Apa's resignation was mutually agreed.
And no surprise that Dale Bramley is taking over. Lester Levy has worked with Dale before at the Waitamatā DHB.
Also starting today, mental health peer support workers at Auckland City Hospital's emergency department.
I'd expect our peer support workers to get alongside that person, maybe in a time of crisis or elevation, and help to support them.
In total, 8 emergency departments across the country will trial the new initiative over 2 years, with Waikato, Wellington and Christchurch hospitals due to start their new peer support services in the coming months.
The rollout of this peer support workforce across New Zealand was actually money that was in the ring fence, actually unspent. So I've been able to identify where there is money to be spent.
Funding that's looking ahead might not be so easy to secure as the health sector moves in a new direction under new leadership.